Let me ask you something personal. Have you ever stepped into a warm morning shower only to feel your head spin, your heart races, your legs wobble, and for a second, just a second, you wonder if something inside your body has changed forever? If that's ever happened to you, you're not alone. And no, it's not just getting older. My name is Dr. Samuel Blake. I've spent over 30 years as a neurologist walking beside older adults through memory loss, stroke, and brain recovery. And I've learned something most doctors never tell you. The danger doesn't always come from smoking or high cholesterol. Sometimes it comes from what you do in the safest place in your home, your bathroom. Yes, your morning shower routine. That comfortable habit you've done for decades, it could be quietly raising your risk of a stroke. No chest pain, no warning, just a moment of dizziness. And then, slurred words, a dropped arm. A brain that's gasping for oxygen before you even know what happened. But I'm not here to scare you. I'm here to protect you. Because I've seen what happens when good people, strong people, don't get warned in time. And I've also seen what happens when they do. Today, I'm going to walk you through 9 common shower habits that could be putting your brain at risk and exactly how to correct them safely, gently, and wisely. If you've ever felt dizzy, faint, or foggy in the shower, type the number 1 in the comments. If not, type 0. I still want to know you're here because this message could save someone you love. And if you want to stay sharp and independent past 60, subscribe and turn on that little bell. We're just getting started. Number 1, heat versus age. Why hot showers starve the brain. Let me tell you about a man I'll never forget. His name was Leonard, a 75-year-old retired carpenter from Pennsylvania. For over 4 decades, Leonard followed the same morning ritual. Wake up at 6, no breakfast, walk straight to the bathroom, turn the hot water up, and stand under the steam for 20 minutes. He said it helped ease his back pain and made him feel awake. But one day, his wife found him sitting in the shower, confused. His speech was slurred. One side of his face looked droopy. He hadn't slipped. He hadn't fallen. And yet, his brain had been starved of oxygen. What happened? It all comes down to how heat affects an aging body. When you first step into a hot shower, especially in the early morning, the warm water causes your blood vessels to open up very quickly. This sudden dilation lowers your blood pressure. At the same time, your body is still waking up from hours of lying down, when blood flow is already slower. Now imagine this happening in a 70 or 80-year-old body. The blood pressure drops too fast. The brain, already dealing with stiff arteries, does not get enough oxygen in those first few minutes. And when oxygen is low, brain cells start to suffer almost immediately. That's how strokes begin. Quietly, silently, no warning. Leonard did not feel any pain. He did not realize anything was wrong until the words stopped coming out clearly. The brain does not care that you have done the same routine for 40 years. It only knows how much oxygen it gets today. For younger adults, a hot shower may only cause a little dizziness. But for older adults, it can trigger a chain reaction, low blood pressure, reduced circulation to the brain, formation of a blood clot, and suddenly a life-changing stroke. Now let me ask you, have you ever stood up too quickly and felt a little lightheaded? Have you ever needed to lean on the wall after stepping into the shower? That could be your brain telling you something. So, what should you do instead? First, always wake up slowly. Sit at the edge of the bed for a minute or two. Drink a full glass of room temperature water. This simple step helps your blood pressure stabilize. Then wait at least 20 to 30 minutes before getting into the shower. Let your body fully adjust to being upright. And when you do shower, make the water warm, not hot. Warm water soothes, hot water shocks. You do not need to punish your body to feel clean. You need to protect it. Leonard recovered with physical therapy. but his speech has never been quite the same. And every time I visit him, he says, "Doc, I thought I was doing something good for myself. I had no idea I was starving my brain." And that's the truth for so many people over 60. What once felt healing now becomes harmful. So I say this with love. If you've used hot water to wake up for years, it may be time to change that habit, not because you're weak, but because your brain deserves better care now than ever before. If you've ever taken a hot shower in the morning and felt even a little dizzy or tired afterward, tell me in the comments. Type the number 1 so I know I'm not alone in this fight for awareness. If you've never felt that way, type the number 0. I still want to hear from you. We can help each other stay safe, one morning at a time. Now, let's move to the second danger that might surprise you even more. It's not about heat. It's about what happens when the cold hits your skin and your heart is not ready. Number 2, sudden cold showers and the aging heart. Now let's talk about the opposite problem, not heat, but cold. You've probably heard that cold showers are good for circulation. Maybe you've even tried ending your shower with a quick icy blast. It sounds healthy, it sounds brave. But for people over 60, especially those with heart conditions, this brave habit might be dangerously misunderstood. Let me tell you about Robert. He was 79, a retired firefighter from Wisconsin. Strong, disciplined. He told me, "Doc, I still do push-ups every morning." One day, he came into my office after suffering what we call a mini stroke, a transient ischemic attack. It had hit him right after his shower. What went wrong? It turns out he had read online that cold showers improve brain health. So every morning after his warm shower, he would stand under freezing water for 30 seconds. For a few weeks, he felt sharper, until one winter morning, the cold water hit his chest, and so did the panic. His heart raced. He collapsed. His wife found him moments later. You see, sudden cold shocks the aging nervous system. It causes blood vessels to constrict too quickly. That raises blood pressure, places strain on the heart, and for many seniors creates a spike that the body cannot handle. In Robert's case, that spike triggered a clot to dislodge. It traveled to his brain and briefly blocked oxygen. Just a few seconds of cold had nearly changed his life forever. Now, I'm not saying cold water is evil, but sudden cold, without preparation, can be too much, especially when you're older, especially in the morning, especially if you already have high blood pressure or take heart medications. So, what's the better approach? If you enjoy cool water, lower the temperature gradually. Let your body adjust. Avoid switching from warm to freezing in seconds. And if you've ever felt your heart flutter during a cold shower, don't ignore it. That's not just discomfort. That's your body saying, "I can't keep up." Robert now skips the cold rinse. Instead, he walks every morning for 10 minutes. His brain is sharper than ever. And when I asked him why he changed, he said, "I'd rather be warm and alive than cold and on the bathroom floor." Let me ask you, have you ever ended your shower with cold water? Did you feel dizzy or breathless afterward? Tell me in the comments. If you've experienced that, type the number 1. If not, type 0. I'm here to listen. And if you think cold was surprising, wait until you hear what time of day is most dangerous for a shower. It's not what you think. Let's talk about it next. Number 3, why early morning showers could trigger a stroke. Now let me ask you something. What time do you usually shower? 6 in the morning, maybe 5:30. That peaceful hour before the world wakes up. Sounds like a great start to the day, right? But what if I told you that time of day, between 5 and 8 in the morning, is one of the most dangerous windows for your brain? This might surprise you, but the early morning hours are a hidden storm. Your body, after resting all night, begins to shift gears. Your brain releases cortisol, the stress hormone, naturally to wake you up. Your blood pressure rises sharply. Your blood vessels are still stiff. You're usually dehydrated. And if you add heat, steam, and standing too long? That's a perfect storm. Let me introduce you to Carol. She's 83 years old, a retired piano teacher from Ohio. For 30 years, her routine was flawless. Wake up at 6, shower by 6:15, breakfast by 7. Structure gave her comfort until one morning she didn't come to breakfast. Her daughter found her on the bathroom floor, one arm limp, her mouth twisted. She had suffered an ischemic stroke caused by a clot blocking oxygen to her brain. It wasn't her diet. It wasn't her heart. It was the timing, that early morning spike in cortisol, the warm shower, an empty stomach, no water in her system, and her brain said, I can't handle this. You see, as we age, our arteries are less flexible. Our blood pressure regulation weakens. We don't bounce back from sudden shifts like we used to. That's why morning showers, especially too early, can be risky. What can you do? Push your shower later, at least 45 minutes after waking. Drink a full glass of water. Eat a light snack, a banana, half a piece of toast. Give your brain what it needs: time, hydration, and oxygen. Because when you do that, you're not just delaying a shower. You're buying protection for your memory, your speech, your ability to live independently. And believe me, I've seen too many people lose all of that just because no one warned them. Let me ask you, have you ever showered early and felt weak or tired afterward? Type number 1 in the comments if that sounds familiar. Or type 0 if this is new to you, but helpful. Every response matters because your story could help someone else avoid a stroke. And now, let's talk about the most dangerous part of your shower that isn't about time or temperature. It's right under your feet. Number 4, slippery floors and stroke-inducing falls. I want you to picture this. You're stepping into your shower. The tile is a little wet. Your balance feels fine until it doesn't. Your foot slides. There's nothing to grab. And in one instant, your body hits the ground. But it's not just the fall that hurts you. It's what happens inside your brain. This is what happened to Mr. William Turner. He was 82 years old, a proud veteran, lived alone, took care of himself, never asked for help. One morning, he slipped while stepping into his tub, hit the back of his head on the porcelain wall. At first, he thought he was okay, but within an hour, he couldn't move his left leg. His speech became slow. What happened? The trauma of the fall caused a clot in his brain to shift, or maybe it ruptured a fragile blood vessel. Either way, he had suffered a stroke. You see, for people over 60, a simple slip in the bathroom is not just a bruise or a bump. It can be a life-changing event. Why? Because aging arteries are thinner, reflexes are slower. Medications like blood thinners make the brain even more vulnerable to internal bleeding. The bathroom is the number 1 place where seniors fall, and the shower is the number 1 danger zone. Yet most homes have no grab bars, no shower chair, no non-slip mat, just a smooth, wet surface and the hope that nothing bad will happen. Let me be clear. This isn't about giving up independence. It's about protecting it. Because when you install support bars, use a shower chair, or add a rubber mat, you're not admitting weakness. You're showing wisdom. Mr. Turner survived his stroke, but he now lives in assisted care. He told me once, "Doc, I survived a war, but I lost my freedom to my own bathroom floor." And he's right. The danger wasn't loud. It was silent, slick, and under his feet. So please, if your bathroom doesn't have grab bars, get them installed. If your tub has no grip, place a non-slip mat. If standing is tiring, get a seat. These are not optional after 60. They're essential. Have you ever slipped or nearly slipped in your bathroom? Type 1 in the comments if yes. Type 0 if no. But promise me you'll check your shower today, because the next danger is one most people never think about: but it's in the air you breathe while you shower. Let's talk about that next. Number 5, poor ventilation and oxygen loss in the shower. Close your eyes for a moment. Picture a warm, steamy bathroom. The mirror is fogged. The air feels thick, like a blanket wrapped around you. It's quiet. It feels safe. But inside your brain, something dangerous is happening. When your bathroom doesn't have proper ventilation, no open window, no running fan, you're breathing in warm, moist air with less and less oxygen. And for older adults, that low oxygen level becomes a silent thief. It doesn't happen all at once. At first, you may feel sleepy, then a little dizzy. Then your thoughts slow down. That's not aging. That's low oxygen, what doctors call hypoxia. Let me tell you about Mrs. Elaine Foster. She's 77 years old, a retired choir director from Illinois. For weeks, she told me she was feeling foggy in the mornings, slurred speech, hard to concentrate. She thought it was the start of dementia. We ran tests, scans, labs. Everything looked normal. Until I asked about her shower routine. Every morning, she would take a long, hot shower. With the bathroom door closed, no fan, and no window open. She said, "I love the steam. It soothes my joints." But that steam was robbing her brain of oxygen. Her bathroom had become a low oxygen chamber, and her brain was paying the price. Once we made simple changes, opening the window, turning on the fan, shortening her showers, her symptoms disappeared in a week. She looked at me and said, "Doc, I thought I was losing my mind, but it was just the air I was breathing." This is more common than people realize. As we age, our lungs lose elasticity, our heart works harder, and when we breathe thick, moist air in a closed space, our brain can become oxygen deprived without any warning. That oxygen loss triggers confusion, dizziness, and in some cases, stroke. So please don't underestimate ventilation. Open a window even in winter. Run the fan. Leave the door cracked. Fresh air is not a luxury. It's life support for your brain. Let me ask you, do you shower with the window closed and no fan on? If so, type 1 in the comments. If you always ventilate your bathroom, type 0 and share your tips to help others stay safe. Next, I want to show you a mistake that often happens right after breakfast. You may think you're being productive, but your brain might be paying the price. Number 6, showering right after meals, a hidden danger. Let me guess. You like to shower right after breakfast, or maybe after lunch. It feels practical, clean, efficient. You eat, then freshen up. What could be wrong with that? Well, here's what most people don't realize, especially after 60. After you eat, your body naturally sends extra blood to your stomach and intestines. It's a process called post-meal blood redistribution. Your digestive system needs that blood to break down food. But here's the problem. If you shower right after a meal, especially with warm water, your skin's blood vessels expand. Now your blood is being pulled in two directions, your gut and your skin. And guess what part of your body loses out? Your brain. Let me tell you about Hattie Reynolds. She was 80 years old, a gentle, kind woman from Alabama. Every morning, she'd eat her oatmeal and coffee at 7:30. And by 8 o'clock, she was in the shower. Until one morning, her husband heard a thud. She had collapsed. At the hospital, we found a small clot had traveled to her brain. She had suffered a mild ischemic stroke, likely triggered by low cerebral blood flow right after digestion had claimed her blood supply. And it broke her heart. She said, "I thought I was doing the right thing. Eat, then shower. I've done it for years." But her aging arteries and slowed circulation couldn't keep up, and the warm shower pulled even more blood away from her brain. You see, timing matters. The older we get, the more delicate the balance becomes. So here's what I tell all my patients. Wait at least 30 to 45 minutes after eating before you shower. Drink water. Sit up. Let your food settle. Give your blood a chance to support digestion before you challenge it with heat and standing. It's not about fear, it's about flow, about giving your brain the oxygen it needs, especially when your circulation is already working overtime. Let me ask you, have you ever showered right after a meal? Did you feel lightheaded afterward? Type 1 if this sounds familiar. Type 0 if this is new for you. And if it helped, tell me how long you usually wait after eating before you shower. Your habit may inspire someone else to stay safe. And now, even if you wait the perfect amount of time, even if you hydrate and stretch, there's another risk. It's not about food or air. It's about how long you stand still and what that does to your blood. Number 7, standing too long in the shower, a hidden threat to your brain and legs. Let me paint a picture. You're in the shower, warm water on your back. You're standing still, eyes closed, just enjoying the moment. But while you're relaxing, your blood may be pooling in your legs, and your brain might be quietly running out of oxygen. This is one of the most overlooked dangers for people over 60. Standing still for too long, especially in warm water. Here's why. Your leg muscles help pump blood back to your heart and brain. But as we age, those muscles weaken. When you stand still, especially without moving, blood collects in the lower body. Add warm water, your blood vessels expand. That slows the return of blood to your brain even more. The result? Low blood pressure, dizziness, fainting, and in some cases, stroke when clots form or oxygen supply drops too low. I remember Mr. Harold Dawson. He was 81, a retired mail carrier from Iowa, strong, independent, proud. He told me, "Doc, the shower's my favorite part of the day. I stand in there for 20 minutes. It's the only time I feel at peace." One morning, he fainted. His wife found him slumped in the corner of the shower, still breathing, but unable to move his left arm. He had suffered a mild stroke caused by a clot that likely formed while standing too long in warm water. That's the cruel part. He wasn't doing anything wrong. But he didn't know his legs weren't pumping blood like they used to. So here's what I recommend. If you're standing in the shower longer than 5 minutes, use a chair. Rest. Sit. Let your legs recover. Install grab bars. Keep the soap and shampoo within reach so you don't twist or reach unnecessarily. Your independence does not depend on standing up for 20 minutes. It depends on staying safe so you can live fully. Let me ask you, have you ever felt lightheaded while standing in the shower? Type 1 in the comments if yes. Type 0 if not, yet. But promise me this. Tomorrow, time your shower. Sit if you need to. And know that a simple 5-minute adjustment could save your brain. But even if you sit, even if you move slowly, there's still one more thing that could catch you off guard. The way you twist, the way you bend. Let's talk about that next. Number 8, sudden bending and twisting, the invisible stroke trigger. Let me ask you something. Have you ever bent over quickly in the shower? To pick up a dropped bar of soap? To grab your towel? To rinse your legs? It feels like nothing. But for the aging brain, that movement might be more dangerous than you think. You see, when you suddenly bend down, twist your waist, or raise your arms above your head, your blood pressure shifts fast. In young bodies, the brain adjusts instantly. But in older adults, the reflexes that keep blood flowing evenly begin to slow down. This is called orthostatic hypotension, a sudden drop in blood pressure when changing positions. And when it happens in a hot, steamy shower, your brain may not get the oxygen it needs. The result? You feel dizzy, off balance, and sometimes out of nowhere, you collapse. That's exactly what happened to Gloria Bennett. She was 76, a retired bookkeeper from New Jersey, independent, lived alone. She bent down to pick up her razor in the shower and woke up on the bathroom floor. She had blacked out. Paramedics found her confused, her speech slurred. Scans showed a small clot in her left parietal lobe, a minor stroke likely triggered by sudden movement and low cerebral blood flow. "I just bent over," she told me in tears. "That's all I did." But the truth is, our bodies change with age. What felt automatic at 40 becomes risky at 70. That's not failure. That's biology. And wisdom means working with it, not against it. So here's my advice. In the shower, avoid sudden bending or twisting. Keep everything within reach. Use a handheld shower head. And if you must bend, hold on to something stable. Because even one unexpected movement can tip your brain into oxygen debt. Let me ask you, have you ever turned or bent quickly and felt your head spin? If yes, type 1. If no, type 0. And if you've fallen or fainted while showering before, share your story because someone else might learn from your experience. Next, we'll talk about one final habit. It's something most people think is healthy. But if you do it right before stepping into the shower, it could become the most dangerous decision of your day. Number 9, showering right after taking medications. A stroke risk no one talks about. This one might surprise you most. Imagine this. You wake up, take your morning pills with a glass of water, and then step right into the shower. You've done this routine for years. It feels normal, responsible, even healthy. But if you're over 60, and especially if you're taking blood pressure or heart medications, that small habit could quietly be setting you up for a stroke. Let me explain why. Many medications taken in the morning, like diuretics, calcium channel blockers, beta blockers, or ACE inhibitors, are designed to lower blood pressure or relax blood vessels. They're helpful, life-saving, but they also make your blood pressure more sensitive, especially in the first hour after taking them. Now combine that with a warm shower, steam, heat, standing upright. Suddenly, your blood pressure drops lower than your body can handle. You might feel lightheaded, a little off, or you might not feel anything at all until it's too late. Let me tell you about Mr. Dennis Morgan. He was 79, a retired auto mechanic from Ohio. Every morning, like clockwork, he took his meds at 6:45, then showered at 7. One day his wife heard a loud thump. She found him on the shower floor, breathing, conscious, but confused. At the hospital, a CT scan showed a clot in the frontal part of his brain. He had suffered a mild ischemic stroke, likely triggered by a sudden blood pressure drop from medication combined with the heat of the shower. He told me, "I thought I was doing everything right." And that's the heartbreaking part. He was. But no one had warned him about timing. So here's what I tell every senior I work with. After taking your medications, especially blood pressure pills, wait at least 30 to 45 minutes before you shower. Let your body absorb the medicine. Let your pressure stabilize. Drink water. Sit upright. Eat something light, even a few bites of toast. This isn't overcaution, it's brain protection. Because when your blood vessels are relaxed by medication and you add steam and heat, the combination can quietly starve your brain of blood and oxygen. Let me ask you, do you usually shower within 30 minutes of taking your pills? Type 1 if yes, type 0 if no. And please, if this made you think twice about your routine, share it. Someone you love might be making the same mistake. Now that you've made it this far, you might be wondering, is it even safe to shower at all? Yes, but only if you do it wisely. Let me show you exactly how. Number 10, the safe way to shower. After 60, step by step, after everything we've just walked through. You might be wondering, is it still safe to shower after 60? Yes, absolutely yes. but only if you treat your shower like what it truly is, a physical event that affects your heart, your brain, and your blood flow. Let me walk you through exactly how I teach my patients to shower safely, step by step. Step 1, wake up slowly. Don't jump out of bed. Sit up. Take a deep breath. Drink a full glass of room temperature water. Let your blood pressure stabilize before you stand up. Step 2, wait before you shower. If you've just taken your morning medications, especially blood pressure or heart pills, wait at least 30 to 45 minutes. Let the medicine settle. Give your body time. Step 3, eat something small. Don't shower on an empty stomach. A banana, a boiled egg, half a slice of toast, anything to avoid low blood sugar and improve blood flow to the brain. Step 4, check your environment. Turn on the bathroom fan. Open the window, even just a little. Crack the door. Let fresh air in. Step 5, keep your shower short and warm, not hot. 5 to 10 minutes is enough. Warm, soothing, not scalding. Hot water dilates vessels too quickly. That's when pressure crashes. Step 6, don't stand the whole time. Use a shower chair. Sit if you feel tired. Let your legs rest and your brain breathe. Step 7, avoid bending, twisting, or sudden movements. Keep shampoo and soap within easy reach. Use a handheld shower head. Move slowly, carefully, and with support. Step 8, exit safely. Hold on to grab bars. Dry off slowly. Sit if needed. Let your body adjust back to room temperature before dressing. These small changes, just a few minutes of awareness, can protect your brain, your independence, your life. Mr. Dawson, the mail carrier, now showers sitting down with a timer. Mrs. Foster, the choir director, opens her window and keeps her shower under 5 minutes. Mr. Morgan, who once collapsed, now waits 45 minutes after meds before stepping into the water. They all changed how they shower. And they're all living safer, longer, and more confidently. So I ask you, are you ready to change your routine? Not because you're fragile, but because you're wise. Now, in the final message, let me share what this is really about. Not just habits, not just safety, but the powerful truth that your small daily choices might be the greatest medicine you ever take. There comes a moment in every life when we realize that strength doesn't come from standing taller, it comes from standing wiser. We don't lose our health all at once. We lose it in small things. A skipped glass of water, a hot shower taken too soon, a habit no one ever warned us about. But today, now, you have awareness. And with that, you have power. So don't wait for a warning sign. Let this be your moment. The moment you slow down. The moment you listen to your body. The moment you choose to protect your brain, your balance, your voice. Because every time you choose to wait before you shower, to sit down, to breathe fresh air, you are choosing independence. You are choosing memory. You are choosing life. So let me ask you, what will you change tomorrow morning? Leave your answer in the comments. I want to hear from you. And if this video helped you, even just one part, type the number 1 in the comments so I know we're in this together. Now, before you go, if you found this helpful, there's something else you need to see. Because even if you shower perfectly, even if you move slowly and hydrate well, there could be something inside your refrigerator tonight, a vegetable you've trusted for years, that may silently raise your stroke risk while you sleep. Yes, I said vegetable. Click on the next video right here. Over 60? These 5 vegetables raise stroke risk overnight. And discover the surprising foods that might be working against your brain. Because protecting your brain doesn't stop in the bathroom. It starts at the table. You're never too old to protect what matters. And your brain, it's worth protecting every single day.